was about on 300 milligrams.
Hello and welcome to another video. Dr. Sil here, junior doctor from Sydney, Australia. Today we're doing a reaction to the My Struggle with Anxiety and Depression Giana interview on the Soft White Underbelly YouTube channel. Definitely check that channel out. Incredible interviews on it. I'm finishing up another term in mental health. I've just finished my forensic psychiatry placement, and so it'll be good to listen to some more mental health content, and I can provide some interpretations about what they're talking about and give some more context from maybe a psychiatry point of view. Anxiety and depression are two of the most common disorders, mental health disorders in the world. They contribute to incredible amounts of morbidity and mortality, and I could talk about them for hours. So to avoid that, let's just begin the video.
All right, Giana.
Hi.
Giana, where'd you grow up? Where are you from originally?
I grew up in Seattle, Washington.
Seattle.
I was born in Vegas I was there for 3 years, and then my parents had divorced, and so mainly grew up all the way through in Seattle.
And how would you describe your childhood?
It was good. I had me and my little sister. When my mom and dad split, my dad was still pretty active in my life, but more virtually, just kind of like calls every day. Since he was in Vegas, he would make trips to see us. So a lot of back and forth with that. But overall, just very loving family. Great, yeah, good childhood.
Good childhood. Mm-hmm. That's nice. And you went through high school?
I did. I graduated. Yep.
Excellent. And now, how old are you now? You're
25.
25. Mm-hmm. And at some point, you started having problems with your, probably, how would you describe it? Brain chemistry?
Yeah, it was kind of
Interesting. She was sitting quite still before. Now she's started picking at the fibers of her pants. So she knows the question's coming. She knows why she's there. Obviously, they've been consented to share this information, and you can feel her tension around it.
Around when I was younger, pretty much throwing some crazy fits as a kid does, just but as I still got older, my reaction to things were like a very, very small issue would have me erupt.
So some interesting information shared there. Interesting to hear how she had, like she kind of says the start of her depression was when she started developing these outbursts that weren't proportional to the triggers as a child. I guess it's important to cast a wide, like whenever you approach things from a medical perspective, you always try and keep your differentials really wide. You don't narrow down until you have enough information. So common, disruptive behavioral disorders in kids include ADHD, oppositional defiance disorder, and conduct disorder. And yeah, definitely mood disorders that can present, like major depressive disorder, I guess. Quick point, she says she's sad a lot of times. Just a quick point, sadness and depression, two very different things. Just remember, you can be sad and not be depressed, and you can be depressed and not necessarily feel sad. You can be depressed and just have anhedonia, a lack of enjoyment of anything. That's not really feeling sad. And really, if you can feel happy, if you can feel joy, even if you're sad, like, if say I'm sad because my girlfriend broke up with me and then I won $15 million, I would have both emotions able to happen. Whereas if I was depressed and I made $15 million, I'd feel very blank. I would just feel nothing. I would probably just I might even feel worse. I might say, oh no, now I have to deal with this. So that's a kind of one way to differentiate sadness and depression.
I think my mom was a little, at that time, it wasn't, mental health wasn't as there wasn't a lot of awareness on it. So I think she was kind of stuck too. I don't know if she really.
So rates of depression and anxiety are going up, and there's probably multiple factors to it, but one of the factors is the increased awareness around mental health and the lifting of a lot of the stigma with a lot of the neuroses. I feel like there's still a lot of stigma with the psychoses, but the neuroses like depression, anxiety, people are way more open about talking about it. But the psychoses like schizophrenia and those kind of disorders, that people still don't openly disclose that they have schizophrenia because there's so much stigma around psychosis. So there's increasing rates. But these days, people can come forward with depression and anxiety symptoms much easier to their GPs and things because the stigma's lifted. So it's really good.
Knew what to do, what
It's hard
steps
for a
to
parent.
take. Yeah, I think she just was like, yeah. And then that's when I had gone to see my doctor. They wanted me to try therapy, and I just wasn't having it, and I wasn't clicking with the right person. So I gave the doctor a try.
So therapy. So let's talk about that for a second. The most important predictor in successful therapy, whether it's CBT, ACT, whatever kind of model you're using, is rapport with the therapist. Okay. If you don't like your therapist, it doesn't matter how smart they are. It doesn't matter what model of therapy you're using. Your psychotherapy is not going to be effective. You don't have to like them. You have to respect them and have a rapport with them. I guess if anyone watching this has a mental health problem, the first point of call is your GP, your general health doctor. Okay. They can link you to the right counselors. Just because they're doctors doesn't mean you have to take medication. You don't necessarily need medication for anxiety. You can just treat it with CBT. Even if you're medication averse and you don't want medicine, you should still work with your GP.
And that's where the medication kind of came in. Awareness was not there at the time, so I just had this thought of like, I don't feel like they care to hear my stuff, and that was my mentality. So I never really opened up and gave it a try at that time. And then we just there was only the other option was to go get a doctor that could put me on medication to stabilize the moods.
And tell me about your self.
So I feel pretty confident in saying this. Yeah. You never just need medications. It's never just medicine. Okay. Medicines are a good pair of boots, but you still need to climb the mountain. All right. The mountain is high and you got to do hard work to get up there, but it's way easier to climb that mountain, the mountain being psychotherapy, with a good pair of shoes than it is barefoot. Right. So medicines help you get there. They're really important in mood disorders like depression and anxiety disorders, but they're not enough by themselves. Now that's the case for a lot of like minor neuroses, like the less severe anxiety depression stuff. When you talk about like serious depression with psychosis, when you talk about schizophrenia, when you talk about like psychotic illnesses, they're like psychotherapy has a role, but it's really about the medications in those illnesses because there is just too much dopamine in the brain causing psychotic symptoms. So anyway, that's a little rant about the role of medication.
And then I did move out when I was 18 because I just wanted to keep smoking, and that's how I was self-medicating for a bit, and I still did.
So an interesting point there is, something is considered a mental health disorder if it affects your functional abilities. And what do we mean by function? Because it's such an important concept. And it's like, if it's affecting your relationships, if it's affecting your job, your ability to work, then it's a functional impact. So yes, she was able to keep working, and maybe she was able to keep driving, which is super dangerous. But it fully affected her relationship with her mother and made her move out. So I think that would be considered severe enough to be considered functional impairment and classified as like a drug use disorder if you cannot stop and it's causing problems in your relationships.
When I got on the medication, so I never fully gave up weed, which I know was probably just a big mistake. It wasn't helping. So.
And you started getting prescriptions for psych meds at what age?
Yeah, psych meds was in 2016 or 17, I think. I know I started with the general, the Prozac was the one that I started with.
So Prozac is a selective serotonin reuptake inhibitor. It's a common first-line medication for both depression and anxiety disorders. It works by theoretically increasing the amount of serotonin in the synapses of neurons, promoting serotonergic actions, which improve mood. Most people won't have any side effects, right? So if you take it, you most likely won't get a side effect. If you don't have depression, but you have something else like a bipolar disorder, then starting on an SSRI is very bad because bipolar depression and unipolar depression or major depressive disorder are two very different types of depression, and you can push people into a manic state if they have bipolar disorder. So if you know someone who has depression, started on SSRI, and now they're not sleeping, they're disorganized and hyper energetic and manic, then that could be a red flag. They need to see a doctor right away.
The psychiatrist or the doctor actually hadn't diagnosed me with anything yet. It kind of was just like a, here you go. Like, my mom had explained the episodes I was having, so he thought the Prozac would help. The Prozac was making me feel kind of wired a lot. Definitely couldn't sleep. I was very, very amped up, and I was definitely trying to work on self-awareness through this to be like, what's working and what's not working. So I knew something was wrong. And he had then switched to Zoloft.
Interesting that she was feeling wired and couldn't sleep. I wonder if this was bipolar, triggering into like a hypomanic, like a bipolar type 2, the hypomanic bipolars. Zoloft is just another SSRI class. So if one doesn't work and you're getting side effects, you can try different SSRI. Just remember, SSRI is not addictive, so it's okay to try them. And the other thing is that these things take time. You got to be on an SSRI for like 4 to 6 weeks before you see like it have an impact. So, and then if you want to change SSRIs, you got to slowly wean them and then change them. That takes another, it takes a lot. These things happen over months. So managing mental health it takes time, unfortunately.
Which then did a complete 180 because the Zoloft was treating more of the anxiety, but the depression was there. So for me, I like to think that Prozac was helping my depression, making me happy, but constantly anxious, always. And then the Zoloft was treating the anxiety. So it was going like back and forth.
Really interesting. I can't explain that. That's interesting. Yeah. So it wasn't hypomania. She thinks she felt like it was anxiety, which is common as well. So another big difference between a major depressive disorder and an anxiety disorder is depression. You can fall asleep easily, but you wake up early. Early morning awakening is a classic sign of depression. And the feeling is really bad when you're waking up, like the dread and the horrible and hedonic lack of feeling really is bad in the morning, gets better over the day. Whereas with anxiety, it's hard to fall asleep because you're so anxious, and it has all the physical symptoms of muscle tension, sometimes palpitations, and that awful anticipation of something horrible going to happen, which could be anything. Yeah, if it's a generalized anxiety disorder, at least.
And neither one of those were working for me. And then that is when I met with a psychiatrist that actually diagnosed me with bipolar depression and anxiety.
So there we go. Bipolar depression is very different to unipolar depression, and that explains why the first SSRI was making her go towards a manic or hypomanic state, which could feel like anxiety. Interesting that the sertraline didn't. Maybe it has a decreased rate of, it's called manic switching. Maybe it does that less. But you can take SSRIs while having bipolar. You just have to make sure you have a mood stabilizer on top of it.
Yeah.
And put you on different medications?
Yeah, that's when I switched to lamotrigine, actually, and which is, lamotrigine has, as they explained, it was just like a stabilizer, mood stabilizer. So Prozac would treat one thing, Zoloft would treat the other. I was kind of dealing with the middle ground, so that was like the stabilizer. So it kind of brings your levels to the same. And I think I started, unfortunately, kind of at a high dosage. I think I was about on 300 milligrams of lamotrigine.
Okay, so sorry, couple of things here. Chill still. Okay, lamotrigine, mood stabilizer used in bipolar. You always start with a really low dose. You never start at 300. So maybe she's saying she worked her way up to 300, but you always start with a low dose because it has a small but significant chance of a life-threatening complication. So all the medical students watching this, do you know what it is? It's Stevens-Johnson's syndrome, which is this rash where essentially I shouldn't fearmonger, all right? Lamotrigine is a very safe medicine. You should use it if your doctor recommends it. I won't talk more about the rash, but it can get very gnarly. Okay, I will talk more about it. Essentially, your skin peels off itself, right? The connection between the deeper layers of skin, the top layer of skin dissociate, and you just peel off, and it can kill you. It's horrible.
So during this time, when you're experimenting with different psych meds and also using, were there other drugs as well, or just pot?
So that was kind of the other drugs came in the picture after the psych meds, the lamotrigine, because it was, I was still struggling. And again, the awareness, like I didn't know who to really, it was hard to really talk to people. And so, yeah, I think it was still making me feel.
So just to talk a bit about bipolar illness, bipolar disorder is when you have depression and mania. The depression is really most of the illness. You usually are depressed, and then you might have episodes of mania. Even if you've had one, even if you haven't had it yet, it could be bipolar. But when you have one, then you know it's bipolar. And like depression, is you're in bed, you don't want to move, you feel horrible, you feel guilty, you can't concentrate on things because of how bad you feel and how poorly your brain is functioning. It is organic. Your brain chemistry is different. It is functioning different at a biological level. You can see that in scanners. And, it can affect you can't work, you can't maintain relationships. It's really, really challenging. That's depression. Mania is kind of, in a sense, the opposite. You have so much energy that it's disorganized. You work on a million different projects. You make decisions that are very bad on drugs, sex, money, investments. People started businesses in manic episodes and have lost everything. Mania lasts days, so it can't last 1 hour. If it's lasting 1 hour, then that's an emotional dysregulation thing you would see in a personality disorder. But if it's lasting days, then that's mania. They'll say 1 hour a night for a week or something. Okay, rant over. Let's keep going.
A type of depression, and I don't fully remember. My memory's a little fragmented there, but I know that around the age of 20, I had gone to Molly and cocaine and stuff like that throughout a period of my time, because I was still depressed and still trying to see what I could do to fix it. Probably not, uneducated there, but yeah. And
what kind of effects did all this have on your relationships with friends and your mood?
Yeah, it was, I would say for a time, I probably wasn't fun to be around. When I was really into weed before, because the Molly and cocaine was kind of like trying to fit in again, like going to concerts and things like that. And, I knew it wasn't smart to be mixing the two, like an SSRI and something like that. So
absolutely right. Molly, MDMA, is very serotonergic. SSRI is very serotonergic. What's a life-threatening complication that you can get if you have too much serotonin? Serotonin syndrome. This is when, it starts off with headaches, then you get cramps, then you get a fever, then your pupils pop out, and then you can't focus on anything. You can actually become hypothermic, too hot, and you can, it's a medical emergency. You have to go straight to ED. So don't do drugs if you're on psychoactive medications like SSRIs.
I was trying to be careful, but it was pretty dumb. But before that, when I was just smoking weed and getting high all the time, I lost a pretty good chunk of friends because I was so introverted. I did not want to go out. I turned 21, I had a little bit of fun, and then I just kind of isolated myself from everybody and just was getting high all the time. So I lost some friends that, that was hard, but.
During that period, do you feel like that was the real Giana at that point?
No, it wasn't at all. And in fact, it was like after the lamotrigine, I was still struggling, and I wasn't being very honest with my psychiatrist, which, of course, looking back, I should have been a little more open.
Just be honest with your psychiatrist, guys. If a psychiatrist is judging you, you need a different psychiatrist. We're not here to judge. I'm not a psychiatrist. One day I hope to be, but doctors aren't here to judge. We just need all the information available, all the truth, whatever drugs you're doing, whatever things you're getting up to. We need the information available. It's important that doctors explain the limits of confidentiality with you, but most things we don't have to tell anyone. We don't have to tell anyone if you're doing drugs. If you intend to hurt someone or yourself, then our confidentiality limits are met, and we have to break confidentiality. But if you're not intending to hurt anyone or yourself, then we don't need to tell anyone. You can tell us anything
about it and saying what I was doing. But she had a new drug came to the market. It was like a Latuda. There was commercials for it and stuff, and so.
Oh, Latuda is lorazepam, which is an atypical antipsychotic, which you can't treat anxiety and depression. By the way, she doesn't have anxiety or depression. She has a bipolar illness. So the title of this book, the title of this video is technically incorrect, but anyway, that's fine. Just sharing that. But you can use antipsychotics to help manage bipolar illnesses, yeah. And since it's an atypical antipsychotic, the mechanism is it'll be dopamine blockade, but it'll also be lots of other receptors. Since it's an atypical antipsychotic, but it's effective.
She was like, "Well, I'm gonna put you on, I think 20 or 40 milligrams of Latuda while you're taking the lamotrigine to maybe help you." I think I was telling her I was having trouble sleeping and things like that, and this was supposed to help that, right? So now
antipsychotics often make you drowsy and help sleep. It also helps with the manic aspect of bipolar illness, reduces the kind of, because if you're manic and you're really aroused, it can also lead to psychosis. You can have psychosis with bipolar for sure.
I was kind of double drugging a little on the antidepressants, and the Latuda just took a really bad turn. That was like, and that was only for two or 3 months, but I started like hearing voices, put me in I don't even remember being that way before that drug. Like that wasn't how I wasn't dealing with that. And I was just hearing things. I used to have to sleep with the TV on every night. I had a roommate. I don't really know if she even knew what was going on. And I remember I would have visions of me just blacking out, like completely. I was almost scared to drive a car because I would be driving and feel like I would just drop and lose control. I don't know. It was like, that's what was going through my head all the time.
Interesting side effects to get voices from a dopamine antagonist. I haven't heard of that before. And part of me wonders, this is all speculation in this video and all my videos, but wonders if maybe was she developing a psychotic illness at the same time? I haven't heard of it before.
Like, I think if I didn't have like my mom talking with me and like helping me, I don't know, like I don't really know what would have happened. So that was the hardest one that I had to be like, I just had to tell my psychiatrist that I need to get off of this. I don't think this is right. Something's wrong.
Was there a time where you just wanted to get off of everything and just try that again?
To go just clean?
Clean?
Not at that time. Yeah. No, I still knew, I still wanted.
That triggers me, by the way. I don't like people calling it clean when you're off off psychiatric medications. There's such a big stigma around medicines for mental health. It's like, yes, there's lots of side effects. Guess what the side effects of not taking your antipsychotics are, right? Like way worse. So take your medicines. Anyway, that's coming from someone who doesn't have a psychosis, so I get it. But anyway, for me, that's pretty triggering. It's like clean. It's not clean if what you do without them is way worse.
Actually, my last quarter, one of the last classes I took was on medicine, behavior, and like human. Yeah, that one, I was like, shit, I should have done this. I should have gone down that route. And I still contemplate going back and like doing something in psychology and things like that. And that class that was the one I was reading everything and kind of reading about the stuff I went through. And that was the first sign of like, I didn't feel like I was so alone. And
it also seems like the doctors don't have a really firm understanding of what drug is the right one for maybe a certain patient. So they experiment a bit.
Yeah, totally. And that's like...
My guard went up. I was like, what's this guy about to say about doctors that we don't know? And he was 100% right. We don't have personalized, there's no blood test for schizophrenia. There's no blood test for depression. We cannot diagnose it. And psychiatry is the furthest behind in terms of diagnosis. We do not diagnose based off cause of illness. Like with a heart attack, we know the mechanism of how a heart gets a heart attack. We understand that at a molecular level beautifully. Schizophrenia, depression, like we have this monoamine hypothesis and these ideas around neuroplasticity. The brain is the most complicated organ in the universe. It's very complicated. So we just don't have good understandings of things. And so it's important for us doctors to remain humble, and if, some alternative thing works, then investigate it. And if it doesn't have side effects, do it, anyway.
There's nothing against that. I just think for me, I ended up putting myself in a worse position by trying to self-medicate with other drugs.
Do you feel like you're in a good place today?
Yeah, today is a lot better. I mean, still struggle. I got off of pretty much all the only antidepressant I stayed on was the lamotrigine, because that one really wasn't ever giving me any negative
Just to clarify, it's not an antidepressant, it's a mood stabilizer. Sorry.
side effects at all. The other ones we would try to work in with it was just not, I was even trying to take, after the Latuda and telling them about the voices, I got 150 milligrams of Seroquel, but at that time when I was with my ex, he had said like,
Seroquel, quetiapine, very common antipsychotic. Definitely helps you chill out and go to sleep. Very good for that.
oh, that's something they give schizophrenic. That's a schizophrenic drug, that they.
Yeah, I hate this. I hate the name antipsychotic. Like, I shouldn't be even using it, but it is just the class. That's what it's called. It should just be called dopamine antagonist, because that's what it does. And you can use antipsychotics for non-psychotic illness in this case, right? You got a bipolar diathesis, you got a bipolar illness. You're using an antipsychotic, but it's to block the dopamine receptors. It's not to stop schizophrenia, right?
For schizophrenia, which I think was a misunderstanding, because the Latuda was causing schizophrenia. So treating the schizophrenia that wasn't there anymore with the Latuda, I mean, I was a full zombie.
Just a small point. She's using the word schizophrenia incorrectly, which is fine because it's a technical term technically. You just use psychotic symptoms because schizophrenia is a very specific disorder. In reality, it's probably multiple disorders that we don't well understand, but it's got a very strict diagnostic criteria. So she was getting symptoms of auditory hallucinations, which is one of the symptoms you can see in schizophrenia, but doesn't mean she had schizophrenia.
My body. I mean, if I was on the couch, I was staying on the couch. There's certain drugs you can what I was told was you can taper off of, and then there's certain ones that you can actually just kind of remove and get off of. So Latuda, I didn't have to taper off. I was like, I'm done. I need to be done. The Seroquel, I had to taper a little down to, I think we took it by 50 milligrams, and it was getting a little better. And then finally I just said, no, never mind. So I got rid of that. So now it's only lamotrigine. I've gone from 300 milligrams to 75 today. So.
And do you feel like you're in the best spot you've been since you've been taking these psych meds?
Yeah, I think there's definitely room for improvement, still room for growth and self-work. I can see my future now, because all that time, I did not see anything for myself. It was almost like I would deal with some suicidal thoughts, but I never wanted to. I had all the love and support from my family. It never made me want to make do that action, but definitely was I guess.
So whenever you're talking to anyone with any mental health problem as a doctor, you should ask about suicide. It's a very common misconception that asking about suicide will increase the risk of someone, dying by suicide, but that's not true, or attempting suicide. That is not true, and often it gives people an outlet to talk about it. But you won't give someone the idea of suicide. If their life is tough, and if they were thinking of suicide, you weren't the first one to bring it up. You cannot. It doesn't increase the risk of suicide if you ask about it in a nice, compassionate way that's sensitive. So always ask about suicide.
That's why I could say it is I was okay with dying at any time, because I just did not I didn't see anything for myself. So if I guess that's kind of a weird way to put, I don't know, but.
And Giana, what would you say is the most important thing you've learned through all of this?
Again, it is everybody's own journey, and maybe Latuda worked for some people, things like that, so it's not to say what could work for you, what could not, but just the most important thing I think is being in touch with yourself and your emotions and how you're feeling. That was what worked for me, was just being self-aware of how I was feeling, and just taking the steps that you can to work on you, put yourself first, and I think that's really important.
All right, Giana, thank you so much for sharing your story.
Thank you so much.
I wish you the best of luck.
Awesome, thank you.
Man, I really like Giana. She's so sensible, and measured. She's not saying that lorazepam sucks, no one can ever have it. She's like, oh look, it didn't work for me. Other people can try their own things. Yeah. Anyway, let me know what you guys thought. Was there any other speculations or interpretations you guys would like to make about their mental health, or anything constructive you want to comment on? Leave it in the comments below. If you want to support me personally, you can buy me a coffee at buymeacoffee.com/drsil.au. You can subscribe to the channel, like the video, share it with your friends. That's the best way to help me grow the YouTube channel. And you can also check out my podcast, Doctors Getting Coffee, where I interview doctors and ask them questions about their life and the pros and cons of the different specialties and other things. So that's a really fun podcast. And that's it from me. I guess reflections of this is that it was cool that I picked the bipolar before it actually happened. Like, this was the first time that I watched the video. That wasn't like a scripted thing. She did not have, although she might have felt anxious, she didn't have an anxiety disorder. Although she might have felt depressed, she didn't have unipolar depression. And I guess the key point here is that diagnosis of mental health disorders is complicated. You cannot diagnose yourself, and you certainly can't diagnose your friends, and neither can I, right? This is all speculation in these videos, although in this case I got lucky. But you need a psychiatrist, you need to go see a doctor, you need to get that referral, and you need to see a mental health professional if you want a diagnosis or if you're worried. So that is it for this video. Thank you so much for watching, and I'll see you all in the next video. Bye for now.